Welcome and thanks for joining us for today's HIS Talk webinar, Innovating the Consumer Experience Beyond the EMR with Open Standards. It's brought to you by Priya Health. I'm Lori from HIS Talk and I'll be moderating. We have 4 speakers today in a panel format. Leading the panel discussion is Robin Monks, who is the Executive Vice President of Technology at Priya Health. Joining Robin will be Ryan Howells, the principal at Levitt Partners and program manager of the Karen Alliance, David Labine, vice president of software engineering, Providence Digital Innovation Group, and Kristen Valdez, the CEO at BeWell. With that, I will turn it over to you, Robin.
Thanks so much for the introduction, and welcome everyone, and thanks so much for being with us today. Today's conversation couldn't be more timely. As consumer expectations rise and regulations tighten, the cost of maintaining fragmented proprietary systems is becoming unsustainable. While we've seen real progress in giving patients access to their data, the lack of open standards continues to drive integration costs, slow down innovation, and limit what digital health can truly achieve beyond the EMR. In this webinar, we're going to explain why open standards like OIDC and HL7 FHIR, as well as open technology requirements, aren't just nice to haves, they're actually strategic identifiers that can significantly reduce the burden of integrations, migrations, and workflow changes across healthcare. These systems don't just promise flexibility down the road, they deliver immediate ROI by accelerating development timelines, cutting rework, and lowering the long-term maintenance costs. Throughout our discussion, you'll hear from leaders who've seen firsthand how every closed integration today is a missed opportunity to move faster, smarter, and with less waste. And by the end, our goal for you is to be able to walk away with actionable insights to help reframe open tech not just as a cost, but as a competitive advantage, one that feeds operational efficiency, regulatory readiness, and ultimately patient loyalty. I'm going to go ahead and kind of dive in a little bit here. I'm going to start with you, Kristen. From your perspective, like how have proprietary systems historically limited your ability to serve consumers? And what real-world consequences have you seen when organizations delay adopting open standards?
Yeah, I mean, I would say it's been a real challenge for healthcare technology companies that are trying to provide a service, or what we talk about at the Karen Alliance as an open innovation ecosystem, where apps can emerge and add value into patients' lives all the time. But the data for patients has been strewn across what is more than 2,000 different EHRs that exist in this country, and more than 400 different payer systems, each different, non-standardized, and historically have not been very good at talking to each other. I have my greatest role in life is being the parent of a mom of a child with rare disease who has 26 different clinical patient portals, and none of them are accurate, none of them talk to each other, even today. So having the ability, in my daughter's case, where having access to her data is life-saving, being able to pull all of that information into any app of her choosing that adds value for her or for her family members like myself is really important. And open standards provide a way that we can now do that. And Ryan, knows firsthand, because we've been on this journey together for over a decade, trying to get, industry-wide adoption for open standards technologies. While they're not perfect, they advance us in such a way that not only can we give consumers and their families access to their own medical records through a standard open API, right? So we're not dealing with different data feeds across all of the different doctors across the country, but those open standards also unlock, they unlock more data than has ever been made available before through older, outdated standards. So, if you think about FHIR, one of the beautiful parts of US Core or US CDI v3 is that it opens up progress notes and clinical notes and unstructured data that has not yet previously been made available to patients at scale.
Yeah, and that's incredible value, right? To be able to get that data in one place and actually make it usable. And Dave, I want to look over to you, because I know that Providence submitted feedback to their recent CMS ONC RFI for technology ecosystems. What priorities did Providence advocate for? And as EMR vendors align around OAuth, does that go far enough? I know you have some opinions on OIDC, and I'd love to hear those.
Sure. I mean, health systems like Providence need to create an end-to-end ecosystem of patient-facing applications to deliver the best and most impactful care at the lowest cost. So for example, you know, with primary care visits, these often involve scheduling labs or imaging or other sort of other services. And if proprietary logins are used, you know, multiple logins are required, which adds friction and cost and leads to suboptimal outcomes. Although the EMR systems do expose, you know, mechanisms like OAuth to authorize applications, the login itself is still proprietary. And for example, it won't expose a standard set of profile information that's always required for these sorts of integration that Kristen was talking about. So when we're thinking of OIDC, it's like a digital ID card that proves who you are, along with providing a basic set of profile information. This leads to you know, streamline consumer experiences and business relationships with providers, payers, and other vendors, and it reduces the integration costs. And what we've seen is that these unlock sort of the flywheel effects that we've seen, you know, for e-commerce for decades in other industries. You know, for example, when Providence streamlined our digital journey for labs, we also saw those patients had an increase in bill payment. So for these reasons, in the health tech ecosystem RFI, we've advocated that all patient identities are implemented with the existing global standard, which is OIDC, and we don't think that OAuth by itself goes far enough.
We always like to say portalitis is the diagnosis we can arrive at in our lifetimes.
Yeah.
And I think we're on the verge of that. But Ryan, I know you're really passionate about this subject too.
Yeah, totally. And Ryan, I know that you've been, you know, you've been helping shape national policies for a while. Can you speak a bit around why these are strategic priorities and not just like a technical nice to have?
Yeah, well, I'll tell you a story, Robin. People like stories, maybe. So the first time that Levitt Partners, one of the things we do, we form these alliances to solve these difficult problems in healthcare. We run the Karen Alliance, which is focused on getting consumers digital access to their healthcare information, where, when, and how they want to achieve their goals. So Kristen, with her daughter, who has this this chronic condition, can be able to get the help that she needs in this rare disease. Like, how do we figure out ways to do that? It's always interesting to me when people say, I don't need to have access to any of my health information, and then they engage in a major health crisis, and they're like, no, actually we do. And so, Robin, I'll tell you our story actually is personal, and it's actually very nascent. I have a family member right now that is going through some health challenges, who has not had health challenges previously. So they didn't need access to their health information potentially before. But holy crap, am I logging into the patient app now? Am I trying to look up things in ChatGPT? Like, I am all over it. And because we've got to get this person the care that they need when they need it. Her PCP is actually on vacation this week. Understandable, but like, where do we go? How do we navigate it? How do we figure out what's going on? She has new symptoms. Where does that go? Like, there is, I think it's just sometimes we get into a situation, Robin, where it's kind of out of sight, out of mind, where people feel they don't need any of this information because they're healthy and well today. But for the millions of Americans that are just suffering with this every single day, chronic conditions, chronic disease, whatever the case may be, or just something that they have to manage over time, that is obviously not their fault, but they're in a situation where, how do you figure out a way to be able to effectively treat and be engaged in your care, to have an opportunity for you can say, look, this is my body. I'm trying to get healthy. I'm trying to engage. I have caregivers that are trying to help me as well. And it's all part of that care team to be actively engaged in their own health. So, and as it relates to technology and open standards, they're absolutely critical. Everything that you just said is super important. And the challenge we have in healthcare is that we like to create our own. We think we're really different. We're like unique. We're like this kind of snowflake. We're actually not. We have data. We have systems. They need to be, and we have people, and they need to be sent between the systems to the people. And we can do that with open standards. And we have not only standards inside of healthcare, but standards outside of healthcare, like what we're talking about today, OpenID Connect and other things, where we can leverage that. And we can leverage vendors even from other industries who have been successful in how they attack this problem of moving data between systems and between people. And it's just always baffling to me to say that we're healthcare, we're unique, and so we've got to do our own thing. And I think the days, I know the days of that philosophy, that mentality are ending.
Yeah, totally. And like personally, I come from a background in fintech. And so for me, jumping from fintech and seeing where standards are very open, usually pretty well known, jumping into healthcare, it's a very stark contrast, because you're right. It's very much when I came over to healthcare, I had to relearn everything I thought I knew, because like, what does this acronym mean? I would still get hit with the new acronym like once a week, and I'm like, what the heck does that actually mean? So there's a lot of stuff to still discover. But so many of these are solved problems in other industries. And if we can get the open technical solution over into healthcare, we can create some immediate value. And on the value side, I actually want to ask this question both to Kristen and to Dave. So I'm going to ask you first, Kristen. Like, how do you make the business case to leadership that open standards deliver ROI and not just compliance? Like, how do you convince people that there's value in opening up that data? Who are the data holders?
There's a number of ways you make the business case. First and foremost is when the information blocking and interoperability rules came out, if you take it one step further, right? We had meaningful use that took people from paper records to digital records, and now we're taking them from on-prem installation of legacy technology to modernized technology stacks on the cloud. So open standards and what we brought forward was really just modernization of healthcare going through its internet era, right? We're in our internet era. And so from that perspective, if you think about the business costs today, every healthcare stakeholder is transacting in data from multiple partners, hundreds, thousands of partners, all through different formats, flat files, SFTP sites, all the different ways the data can transact. By adopting open standards, every use case, whether it is through a BAA private contract or it's an open standard, something made available through the treatment use case or something made available through the individual access use case, by transacting in the same standard, your costs from a technology perspective actually go down. Because you can pull everything into one cloud-based repository. You have open APIs that are more easily coded, especially in this world of Gen AI and LLMs. We're on a webinar, so we can't not say it, right? But the truth of the matter is that it actually brings down your healthcare technology costs and needs, because like most engineers aren't fully writing code anymore. They are more of a co-pilot to the code itself. So when you are training to the most documented data models in the world, whether it's for AI use cases on top or even for just getting data into a standard format, your costs go down from a technology perspective, your value goes up. But from an open standards perspective, if you are leveraging US Core, which has more data, you are doing less manual tasks like chart chasing, matching people to clinical trials, being able to go direct to consumer with consent to pull information creates a lifetime loyalty and relationships. And you can open up new business models like non-traditional trial sites and observational research sites where you can actually consent people in to say, from time to time, your medical data might match you to a survey where we want to hear more from you. Would you be interested? So there are entirely new, not only open standards, but there are new use cases that you can think about, new business models that healthcare stakeholders have historically been blocked out of because they didn't have the right data at the right time. But let's not think about care as our first, the triple aim, the quadruple aim, whichever aim that you're after. Being able to get real-time information on somebody contextually when it matters most and guiding them in that moment instead of waiting 45 days, for a medical claim to come in. Our payers always joke, like, how do I avoid a 3-day readmission if I don't know the admission happened in the first place for 40 days after the fact, right? So the ROI on every single part of managing an MLR for a payer or any type of value-based arrangement for a health system, whether it's ACO, Medicare Advantage, MIPS, all have impacts to the bottom line. For the first time in healthcare history, moving to open standards creates an ROI where your technology stack pays for itself versus becomes a line item in your IT budget.
I think that's an awesome way to look at it. And yeah, Dave, you sit on the other side of this, right? Because in health systems, every dollar has to be accounted for. There needs to be a really clear rationale for why you're spending that money. Can you talk a bit about how you're advocating for open standards in that context?
Yeah, and just building on what Kristen said, I mean, a lot of those business models that she's talking about aren't actually possible with you know, using sort of a proprietary identity from the EMR, because you know, those third parties, we've talked to several large vendors, you know, they're reluctant to depend on this, and it locks them into proprietary implementation that can't be reused. Whereas for something like OpenID Connect, you know, they are likely already have an implementation. And then there's additional fees and restrictions with the proprietary implementations that make those new business models difficult. So I guess just also to add to her comment, you know, being on the other side, you know, we do have, just to say again, we do have an OpenID Connect patient identity, which allows us to own the patient relationship directly and sort of support this rich third-party ecosystem of vendors. And as we scaled up, you know, the number of integrated vendors, we've seen the typical e-commerce flywheels. So being a bit more specific, the lab completion rates have doubled, double-digit increases in new users and cash collection, you know, and those all directly impact bottom line. So that's, I mean, for health systems today, that, you know, the thing that we really need to be speaking to. And then the other thing I'll just say is that the integration costs are reduced, because you're talking about configuration generally to you know, onboard new vendors, rather than, you know, when Kristen's talking about all these different data, you know, exchanges and stuff. You have a standard identity to authenticate the user, you know, and then you have these standard data pulls, you know, and that really reduces those integration costs. So those are the, you know, 2 or 3 primary arguments I'd make.
Totally. Yeah, that makes total sense. And it helps to justify, like, why are you spending the effort there as well?
Exactly. Yeah.
And there's also there's a product design piece to this too, because it gives you the freedom to create those kind of custom experiences, as well as to create trust with the user. And I want to maybe just dig in a little bit and go back to you, Ryan. Like, what are the policy shifts, regulatory shifts? What are things that health systems should track now around identity and consent and interoperability? Like, if you're a healthcare executive or you're someone who's a developer at a health system, what are the things from your seat they should be watching for that are interesting, that could kind of reshape both identity and data in the future?
Yeah, I'll answer that just a second, Rob. I want to be really clear about what we're talking about. We're talking about the ability for a consumer to prove their identity once and then federate that identity across multiple systems, okay? So that's what David was talking about just then. That's what Kristen's talking about. So Kristen has a consumer-facing app. That consumer-facing app has to access multiple data systems on behalf of an individual, because that's where their data is located. For David, he has multiple systems of provenance, right? That he's got to be able to, the consumer needs to be able to access in order to get a full picture of everything that they need in order to be proactive managers in their care, whether it's the lab systems, EHR systems, pop health systems. I mean, there are all kinds of things related to that. So what we're talking about is, in the consumer world, we call it like a login with scenario, right? You're basically going to log in with a credential, a digital identity credential, and that digital identity credential is going to then be able to authenticate you across multiple different systems. So, and the way that it does that is the backend technology for the open standard is called OpenID Connect. So why is that now all important? It's important because, as David mentioned, we have all these disparate point solutions. It's crazy. And it is, but some of them are necessary for sure, and they're needed, obviously. Probably all of them are necessary, otherwise David would like throw them out of his system. But the idea is that that if they're all necessary and they all have different logins, there is no seamless consumer experience. It just doesn't exist. And so it's interesting to me that the last few years, especially with health systems, Robin, everybody talks about consumerism and we got to do better things for the consumer, and they never talk about identity, other than the fact that we need a national patient identifier, which doesn't solve this problem of authentication. So we're still stuck. We're like, this is not, so David has a Providence patient identifier, and he can use that to link it to this digital identity credential across all of his systems. I know Priya provides that too. There's an opportunity here to make that happen. So that's the exciting part. Now, what's the policy angle to this, Robin, to answer your question directly? We, in the Caring Alliance, we've been promoting this concept for the last 7 years, since fall of 2017, when we recommended to ONC that they need to adopt these digital credentials. Now, for the fellow nerds that are on this webinar already know this, but fellow nerds in our, it's called the NIST IL2 credential, Identity Assurance Level 2 credential. And it is a NIST standard of the Department of Commerce that has been developed so that you can say this is truly a service that provides an identity credential, because it's identity proof the user. And so as a result of that, just recently, CMS and ONC, ASTP, released an RFI that basically talked about this idea that they want to go all in on making sure, well, let me rephrase that. They asked a question on there, a series of questions around digital identity, IAL2, for providers and for patients, by the way. What does that actually start to look like? They named a few of the companies like Clear and IDB and others that are like that, and obviously Priya and others that are out there, but there's this concept of like, what should we do? Should this be adopted? Should this be accepted related to it? So we're all speculating, but there's a potential that CMS and ONC now are viewing this as a priority. Now, I shouldn't actually say we're speculating because it's a matter of public record that in the CMS quality conference that was held just recently, Amy Gleason, who works for CMS, talked extensively about digital identity and the importance of it and why CMS is interested in it and why they need identity. And she talked about it for both providers and for patients. There was also conversations in a listening session that they had in early June too. So they have now said, not only in the RFI, but also publicly how important this is. Now, if I'm a health system and I've got like David, and I've got 100 billion things to do, and I don't have time to do any of them, why is this a priority? To me, it's a priority not only because there's some consideration and there's some emphasis from a policy perspective, but also it's a priority because don't you want to provide the best experience possible for the people that you serve as a health system? I think that's obviously the goal. And so for that to be the ultimate goal, this disparate chain of events associated with trying to access my information, even within my own health system, we've got to figure out a way to make it much more seamless so that I can have a much more holistic view of who I am and where I go. So that's really what it's about. It's about the individual. And healthcare historically has not been focused on the person. It's been focused on the businesses exchanging data with each other. And so we've got to now start to focus more on the person.
I think there's one point I would add to that, Ryan, that I think is really important. Health systems can't possibly know the person that they're helping today because 80% of healthcare decisions in this country are made by women. That means that Bailey's doctors in her 26 portals, they don't know if it's me, her father, or her, because we're all just using each other's portal credentials, which are not secure, to be able to get done the jobs to be done in healthcare, because we way overemphasized on HIPAA to say everyone must have their own personal private account, and we just felt like proxy was too hard. So one of the great benefits of IAL2, right, and Be Well partnered with Clear many years ago, right, because I always say if you can board an airplane with your face, you should be able to collect your medical record with your face, full stop. We should not have to log into 26 different things, but it helps health systems to know who it is they're communicating with. Anyone with a patient-facing application who's focused on reimagining experiences, you should know that you're talking to me as Bailey's mom, or you're talking to Bailey, right, when you're communicating, and you should know who to contact, because I also caregive, to parents who are aging, not living with me, and I tell payers all the time, like, you can have nurses call my dad all day long, but he's not the one who's going to make sure that the medications are delivered and at the house. He's not going to book the appointment and get himself to the doctor. Like, you need to get to the person who's going to make the decisions in this country. The other thing that we failed to think about was that if we continue down the path of OAuth only, is that people, I don't know if you guys do, I don't remember the name of every doctor I ever saw. So having to have an account is really a gatekeeping function of data, which we need in this era of Gen AI, and knowing people from a digital era perspective, right? You can't know someone unless you know more about them, but we make it too hard for them to go collect and access their information by putting this gatekeeping of a portal identifier in place. It has to go. And the reason that it has to go is, let's just take Bailey. She just moved into adult age. We're very excited about this. But if she wanted to go collect information from a doctor she saw in peds, 5 years ago or 6 years ago, she'll call and say, well, hey, I want to use this API to get my data, but I need a portal account and log in. And they're going to say, well, do you have an appointment? She's going to say, well, no, I don't have an appointment. and she's not going to be able to get an appointment because she's now an adult, she's not in pediatrics. So the whole concept of OAuth breaks down when it comes to consumerism, but it also prevents health systems from truly knowing the people that they are interacting with, which reduces loyalty, it reduces trust, and it reduces engagement.
There's also a ton of friction there, right? Like, I don't have a lot of health concerns. I'm very lucky. I have no hair and no problems, but nonetheless, like, I still have a lot of accounts, right? I have 2 or 3 dentist accounts. I have a bunch of different EMRs for different health systems I've interacted with. And I am great at remembering my passwords, right? I have a password manager, but I went back recently to a health system I've interacted with for over a year and went to log in. It's like, hey, reset your password. Like, we're concerned about your security. You gotta get an email token and reset your password and set a new password, and that password's not strong enough, and you can't use a $ for some reason. And so, you know, you're going through this dance, and all I wanted to do was go back and get a vaccination record from a few years ago. And it took me well over half an hour to get that one piece of data, because there's not a great, like, the system you interact with is not a great system to interact with, and it has a poor user experience from that perspective, and it's not good for that health system that I had to go and spend half an hour to get a COVID result from 2 years ago, right? A COVID vaccination result from 2 years ago. So no, that's a great experience. But I think that also, like, I want to hand it back to Dave. Like, you've gone down this path, right? You're starting to make this a better user experience. You're starting to think about identity. You've taken probably some of the greatest strides of any health system to make identity be a key part of your philosophy. What did you learn about that process? What did you learn about scaling that process? And, you know, what challenges are you facing in that journey?
You know, I think scaling it up, the standards matter, right? Like I said, we talked about before. You know, these new business models, you're dealing with sort of new businesses that haven't traditionally been in working with health systems, and they gravitate towards the existing open global standards, right? And so the only way to get those done is through using open standards. And we have seen, you know, the reduce integration costs that others are talking about, and the flywheel effect. So I mean, it does work. You know, so I think it's generally, you know, more than worth it to put the investment in, you know, even with the early results, like what Kristen was saying about it, you know, it's paying for itself. It absolutely does, right? So those, I think, were the main points we've learned. That, you know, I don't know, others want to chime in.
Yeah, I mean, so Providence patient, a friend of mine's Providence patient, and one of the things that Providence and Pride have been able to do together is to bring that identity to the forefront, and also to start to connect more services like LabCorp into that experience as well.
Exactly.
So if you have identified yourself to Providence, you verified your identity, now LabCorp gives you records as well. And so a friend of mine every year goes and gets his annual physical, you know, very timely, make sure he does it. And then the last couple of years, he's gotten the piece of paper from his doctor that says, here's the lab work you need. And he's walked across the street to the LabCorp clinic, saw that there was a big old line, an hour-long wait to get his blood work done, and then walked away and didn't get his lab work done. So the last 2 years, didn't get his lab work done. This year, same thing happens, right? He sees his doctor, loves his doctor, gets the piece of paper that's been photocopied a bunch of times to go down and get his lab work done, goes across the street, sees a giant line. It's like, I'm not doing this. Didn't do it the last 2 times. Doesn't matter. How important can lab work be? Goes back home. The next morning, thanks to the work that we've done with Priya and with Providence, he gets a notification on his phone, and it says, "Hey, you have lab work due. You should schedule that shit." Maybe I shouldn't swear on this, but nonetheless, I did. You just schedule that, right? And you can, and so he goes and he looks it up, and sure enough, he goes into the Providence app, and now he sees LabCorp locations, and he sees that, hey, I can go across the street from where I live, not where my doctor is, and get lab work done in 20 minutes. And so he schedules it. He goes across the street, he gets it done, discovers he has some high cholesterol, gets the chance to solve that, right? But nonetheless, like, the fact that he now has these things connected and this data is now flowing openly means this person who cares a lot about his health has gone to get his annual physical every year for the last like dozen years, but didn't bother with that one important step, now gets it done because he's doing this. And that's going to lead to, you know, more engagement from him with the health system. It's good for Providence, it's good for LabCorp, and it's great for him, right? And this is the power of actually starting to connect the dots here. And
that
so
person
I think
isn't
really,
me, right? Because totally.
that person isn't you.
Guilty of it.
You are also a friend, Dave, but that's not,
Yeah.
you're not this friend. Yeah,
Yeah.
absolutely.
Yeah.
But yeah, it's totally the case, right? Like making the hard things easy in healthcare.
But you know,
lot of,
and that's a tangible example of so we've seen, I mean, I'm trying to remember the numbers, but because of those types of notifications, patients are far more likely to book, which means they're far more likely to catch, be able to treat those patients in the best way at the lowest cost. And guess what? While they're doing that, they're, oh, I didn't realize I had this bill to pay. I need to go, pay this bill as well. So we've seen, double-digit increases in cash collection, through mechanisms like that. So.
Yeah, totally. Like making things easier for people also makes things easier for people to do other tasks they might be putting off, right?
Exactly.
Whether that be getting blood work done, paying a bill, going through and getting a physical scheduled, all that stuff is important. And the more you can connect with that person, the better off it is that that's going to actually happen. And then, so obviously Providence has taken this step. There's a few other health systems across the US that have taken this step. But it's still nascent, right? It's still one of those things that a lot of people have taken the effort to go through and begin to connect these dots. And I want to come over to you, Ryan. I know you and I have been in a bunch of conversations. We actually heard, probably a month and a half ago now from HHS that, they don't really want to do pilots as much anymore. They want to find early adopters instead. They want to try and push this technology forward in meaningful ways. And as part of the RFI, I view that as a pretty good signal that they want to find good ways to make those things a reality, make that stuff happen. I'm curious, so if we're going kind of like beyond pilots, what are the things that you've seen nationally that drive that adoption, that get people excited in this, that get people wanting to move towards open standards, towards IL2, towards OIDC? What is the driving factor that ignites people?
Yeah, so it's a great tee up for what we do every day, Robin. So it's awesome. So yeah, we bring people together and try to cajole them, prod them, encourage them to like sit around the table with engineers and get new things done that will benefit everybody. And we use open standards to make that happen. So let's give the example of the Caring Alliance. We've got about 80 organizations represented there, and they're all focused on organizations that want to be able to leverage open standards to solve use cases. So let's talk about another use case outside of identity just real quick about what that power can do when you actually convene folks. About a big health system, it wasn't Providence, but a big health system told us one time that, and Providence may be the same or different, I don't know, about 30% of the time when a patient actually shows up to a doctor's office, they've forgotten their insurance card, their paper insurance card, just don't have it. So a lot of the things that David talked about collections is related to the fact that they're trying to figure out, there's a whole actually billion-dollar industry called revenue cycle management that's about, I got to get paid the amount of money that I was contractually, due as a provider. And because the systems don't talk to each other, I have a huge problem about that. Like I can't be able to get the money that I'm due and that I've contractually, that was contractually obligated to me to actually receive. So, and it's a very painful process. Again, a large health system actually told us they have 1,000 people employed in revenue cycle management, just trying to get paid the money they're owed. And so then you say to yourself, well, how do we make this easier? Well, for that 30% problem, what if the health plan just digitally sent the insurance information over to the provider when the person, the member, selected their PCP during open enrollment? Like that happens like all day long, right? And then why don't you give the digital insurance card to the member so that when they get referred to the specialist and the health insurance plan doesn't know where they went, or maybe they do, maybe they don't, or they're in whatever, they're in a different situation, that they can provide the insurance card digitally to the health system. I mean, that just seems like basic stuff, right? We're filling out clipboards now. We wrote a paper earlier this year called Kill the Clipboard about all of this stuff. And it's like, that just seems so obvious. Well, we developed an open standard, Robin. Nobody forced us to, right? We developed an open standard through HL7 called the Care and IG for Digital Insurance Card. Anyone can go out there and get it now. It's for free. We didn't define what open was, Robin, but free, openly available, non-proprietary, right? That's really what we're talking about. So there it is, go get it. And interestingly enough, Humana and Epic actually went and got one. and they got it and they implemented it. And there is now 1.5 million digital insurance cards in production with over 200,000 being added to it every day. And there's only 2 payers on Epic on this digital insurance card with only a handful of providers, maybe about 30 providers with 200,000 a day. There will be millions, if not billions, of these digital insurance card connections that are being made. Well, guess what's happening? The registration folks are like so excited that all this stuff is preloaded in their system, like they don't have to do these stupid clipboards again. The mothers who are worried about their son or daughter that's going into the physician's office are not as concerned about filling out something that they thought that their doctor already had, right, to do that. And the health systems can get paid what they're owed by the insurance company and others. Like this is a great opportunity for everyone. And it's just, it's boggling, I guess, to me that it's taken us so long to kind of figure this stuff out. And it's like, it's definitely a time, you know, and so we're spending money on things we should not be spending money on. This is a difficult time for a lot of folks in healthcare. I'm very empathetic to that. Honestly, whether you're a payer, provider, or patient, a lot of people are everyone's struggling right now. And I have a lot of empathy for that. But I will tell you, there is so much literal waste in our system on things that we should not be spending money on at all that we could do to improve care and improve the patient experience. Literally billions of dollars that could actually be taken out. And I just gave you one example, and we've got dozens of them, right? Probably hundreds of them to do that. But that goes back to your point earlier, Rob, and that's the power of open standards, right? Let's just put these open standards in place. Let's solve these problems, and let's move on to actually solving real problems, like helping to get Kristen's daughter better. Like that's a great opportunity, right? Let's do that instead.
Totally, yeah, and that's one of those things where, like with the digital health cards, right? That's one of those things where, as someone who, you know, recently changed employers, I got new health insurance, and it took 6 weeks before the time I joined and my insurance started, and I actually got the card. And when I went to the health insurance portal to sign up for an account to see my digital card, I needed my number, which I didn't have yet because it was on the card I didn't have yet. And so you get into these cyclical scenarios. And this is, you know, a very solved problem in other areas. To your point, like now if I go to a bank, if I go to BOA or someone and I sign up for a new credit card, they'll approve me instantly. They'll send me an email and I'll get an option to download their app and put it in Apple Wallet. My card might be 2 weeks away from getting in the mail, but that card's in my Apple Wallet in 20 minutes, right? Because they want me able to access that immediately, and they don't want the cost of trying to wait for me to join their network. There's no reason that same thing can't happen in digital insurance cards. There's no reason that can't happen when it comes to billing, where things are already pre-approved to make things move faster.
Robin, I bought my current house, applied for and got a mortgage 100% online. And I can't even get my insurance information to my doctor, like other than filling out a clipboard, and we're in 2025. Like that's insane, right? Like we've got to just acknowledge the insanity of this. Like we just got to kind of wrap our head around it to the point where it's like, this is a solvable problem that needs to be implemented everywhere using these open standards. Don't go run off and buy a point solution for this, right? And don't go run off and hire more people to figure out ways that you can collect money you're already owed. Like just let's get the open standards in place that allows for this stuff to work.
Yeah, when I get referred to a new dentist, I actually got a big piece of paper with referral information all written in like small Sharpie. They were trying to write everything in the details. And I said, can't you just send that to them? I'm like, well, no. And I'm like, well, why not? I'm like, well, for one thing, their fax machine's not working right now, so we can't send it over. And so like they sent me out the door with this like, and I have it around here somewhere, but I'm not gonna find it right now, this like densely packed hieroglyphic card of like every detail about me from my past dentist to my current dentist, just because there was no way for them to hand that over. Because as much as we are in the, you know, the medical insurance space and the medical space right now in this conversation, there's also lots of things around eye care, dental care that also have integration problems that also aren't being solved in a big way. And they're, you know, not as even organized as it is on the medical side of the equation. And so there's a lot of areas that can be brought forward. And so many of those things connect to other issues. If you're someone who has diabetes, if you're someone who has other issues where those pieces around eye care are super important, getting that data in just isn't happening today. We need to be able to build those pathways and get them connected. We've spent like a bunch of time here on why it matters, why it's important. I want to just shift a little bit to the practical. Like, I think everyone, hopefully everyone on the call at this point, everyone listening to the recording is like bought into this matters, but might be wondering, how do I even get started? How do I even do this? How do I initiate this change? I'm gonna point over to you, David, because you've done this inside of Providence. You've done this work.
Yeah.
Like, how would you like pitch this? How would you get people excited to make a transition towards open standards and open technology?
Well, take a look at all the applications. You know, we've talked about sort of the end-to-end journey. Take a look at all the applications you need to integrate with to provide a seamless patient experience. And, you know, I define seamless as, you know, Ryan talked about that earlier, but the most complete care with the fewest steps and the lowest cost to operate, right? So typically, you know, we've seen primary care, you mentioned labs, you know, imaging, payer interactions, wellness apps are sort of new business opportunities. How many of these for you as a current health system, how many of these are currently fragmented due to multiple islands of patient identity or this portalitis that Kristen was mentioning? And how would your business change if you saw double-digit increases in engagement, completion rates, you know, across the board, right? And so it's pretty easy to find the massive, the transformational value through doing that, even with just some of the simple use cases we talked about, like labs and insurance information. So that's sort of how I would get started, you know, and how we got started at Providence.
Totally. And then, like, when you're making those conversations, I'm really curious when it comes to those conversations, where you find the biggest advocates inside the health system. Like, where are you going and find the person who's like fully on board for making that work happen? Like, where do you go to find the person who has the drive to engage with those conversations?
You know, the chief digital officers or transformational officers are generally the folks who recognize, you know, that we have sort of this larger ecosystem of applications that we need to integrate with. You know, that's what I've typically seen.
Yeah, that makes total sense. And I know one of the things that we've discussed in the past, Kristen, as well, is like you're trying to also make these connections. You want an open standard. You want everything to be consistent for your experience and be well, but you're also still trying to convince people that it matters, right? That there's value downstream to share this information. What are the talking points that you're using? What are the things that you're seeing as far as where that first step can be towards becoming more interoperable when you're speaking to maybe a small clinic or a small health system that doesn't have a lot of resources? Why would it matter to them to get on board?
Yeah, I mean, one of the biggest pain points we hear all the time is the country is not going to stop trying to shift to value and away from fee for service, right? Even the government has said by 2025, they want every beneficiary enrolled in a value-based program of some kind. So effectively, we're kind of teaching our health systems to be population health or risk managers like insurance companies had to do with the implementation of, you know, Medicare Advantage or just insurance in general, right? You can't care for someone if you can't see the whole person. Now, there's kind of the elephant in the room, right? Which is like, oh, well, I already have this vendor and they do everything for me, versus, and then you're stuck to someone's roadmap, and the same roadmap that everyone else in the country is on. And if you're on that same roadmap, then there is no innovation. There is no competition because everyone looks the same. And you've basically commoditized our healthcare delivery system. So we need to decide whether or not that is the right approach, or from an open standards perspective, we give power and control to the Providences of the world, to payers, to providers, to pharmacies. I don't know a payer, provider, or pharmacy that is not already planning strategically for what is the pharmacy of the future, what is the health plan of the future, what is the health system of the future. Because with Gen AI, we're leapfrogging from a technology perspective. So if you have any aspirations as a system to control your own destiny, to participate in your own business models, to bring in your own partners that integrate seamlessly, you have to take autonomous control. And the way that I always like to say this is, we should not be competing on access to data. We should be competing on the value we're adding on top of it. And that's why the government gets involved, is they have to create the regulatory floor. Like Ryan always says this all the time, like regulatory should be the floor. It's the must-haves. And then everything else that we allow on top of that, We should be competing with each other to make a better, smarter, faster industry that makes people healthier, cures rare disease, gets drugs to market faster, eliminates the $1 trillion fraud, waste, and abuse problem, that we have in this country. Because if we just solved that, we could pay for so much of the things that we're cutting out right now. But we can't allow competition to come in and do that if we maintain that we are going to grow a natural monopoly, and ultimately of 1 or 2 or 3 major players, right, in the healthcare delivery system, who are all on one unified roadmap, which means that we all move at their pace and nothing more. So how you get started is you find the people who are interested in especially on health systems, which is really hard. How do you disrupt yourself in a time of many times negative margins to move to value versus fee for service? They recognize very quickly that they don't have all of the data that they need on a human, and that it involves way more than the average 2.4 times a year someone goes to the doctor, because health happens the 90% outside of that. So you got to be able to integrate the wearables, the home, the labs, the vision, the dental, like all of the things. And Ryan said something very clear, which is like, why did it take us so long to figure all this out? And I would actually change that statement. It didn't take us very long to figure out the technology part of it at all. It didn't even take us a long time to prove it out. Adoption is what is taking the long time, because we need to be a lot more brave in healthcare. We need to be a little bit less risk averse. And I don't say that lightly, but there are very safe things that we can and should be doing. And the open standards are there for the taking. I mean, BWell's been developing a FHIR server for 10 years. It's an open standard. It's an open model. Anyone can go access it, use it, or install it. We just did the same thing with the International Patient Summary. So when Ryan convenes these coalition of the willings, right, and it doesn't matter which role you play in healthcare, it's about how do you bring people who really care about the change that needs to happen in healthcare for better experiences, and then how do you get them to share their work instead of restrict or stiff arm people out? And we shouldn't be in the business of picking winners and losers. Patients and their families should be in that business, and no one else.
Yeah, it's totally, and that's a very powerful statement. It's one of those things where open standards, open preferences matter. It's not just in the clinical space, right? The clinical space is those couple times a year for most people. It's in how they interact with their daily world outside of that. Like when I recently had a surgery, I was told, hey, make sure you have a bunch of vitamin D for the next 90 days. Make sure you include more of it because it's going to help bones heal. It's the #1 reason that bone grafts will fail. Go and do this. And that should be a preference that gets stored in an open system somewhere. So when I then go shopping on my my Uber Eats or my DoorDash, it says, hey, you have a calcium requirement. Make sure you order a little bit of extra milk this time, right? I should be able to, at my option, with my consent, connect those services and have that data shared between those pieces. And I should be able to use, the same ID, maybe it's an Apple MDL or it's an Android MDL. I should be able to log into my healthcare. I should be able to log into my food service app, my Uber. It should all connect to the point where I can make these services work for me at my choice with my consent. I don't want to have anything creepy going on here, but that should be an option I have as a consumer to make the crooked way straight for me. I'm going to kind of start wrapping things up a little bit here and get some final statements. And I want to start with you, Ryan, around, you've heard a lot here on the resources, the roadmap. I know you're doing a lot of great work at Karen. I know that there's also, like, we have some of the best, most fun conversations, frankly, in those Karen Alliance calls. So if you're not involved with that process, I strongly invite you to go and see what's going on. But as far as next steps from here, Ryan, what would be the things you would suggest to folks? I'll start with you, and then I'll circle the room for some last comments on where people should go from here.
Look, I think that if I'm a health system, let's take it from a health system's perspective. If I'm a health system, I mean, I'm putting words in David's mouth, but he's already done all this stuff. So I'm not actually putting words in David's mouth. What I would say is that I'm going to first ask my question, do I want to be in control of my own data? That's the first question actually that I'd ask. Or do I want to cede that to someone else? If the answer is I want to be in control of my own data and I want to use it for various reasons, not just inside my EHR, but outside my EHR, right? Because I've got all these different systems I need to connect to. Then I need a different architecture than I've had before, right? I need an API-based architecture that includes digital identity. That's what I need. So then you say, all right, if the answer is yes, if the answer is no, then status quo. If the answer is yes, then similar to what David said at Providence, they have access to this information inside the EHR, outside the EHR, and allows for the patient to be at the center because they have digital identity, so that authentication, you can prove that person's identity across these different systems. I think the second question then becomes, what type of a consumer experience do I want to provide to the people that I serve, right? And if the answer is truly a seamless experience so that you can push alerts for specific preventative measures and all kinds of things that you want to do, and make sure that they're proactively engaging their care and appointment reminders and making sure that they can appointments across town, to your point, Robin, with their PCP, without their PCP. If you want to do all of that stuff, and there is to David's point too, there's a valid business reason to do all that stuff, right, as well, then prioritize this work. I think it's time for folks to get together. And even though many of these health systems are so resource constrained right now, the greatest thing about this, Robin, is not only that it becomes patient-centric, but all of the things we're talking about are reusable, okay? So I know this is not a webinar to talk about digital quality measures or public health data reporting or any population health reporting, but if you start naming the use cases that health systems have to do, using this open architecture, digital identity and APIs combined, and having the health system control that, you just reuse the same data over and over again, meaning you just send the same API. You send it here for these reasons, you send it here for these reasons, you send it there for those reasons. And you can control that. And your data acquisition costs, your data exchange costs, your overall architecture, all those costs go down, right, over time, because now you have the ability of doing that. And most importantly, you're being able to serve the patient in a way that you've never been able to serve him or her before, right? And you can do that in a really seamless way. And they can take proactive control over their own health. And no matter what happens, there's an opportunity for you to then be able to deliver services in a new and interesting way. So those are kind of the two, I think, main questions we're talking about. And I think there's opportunities that folks may not be realizing as a result. And like we talked about before, HHS and ONC and CMS are super excited about this and this administration, and we're super excited that they are super excited about it, because it's an opportunity for us to advance the ball. These issues are very nonpartisan. Like, we got to get to Kristen's point, we got to get the data to move. It's not whether you've got the data, it's what you do with it. That's super important. And so for all kinds of use cases, for all kinds of reasons. So I think the answer is start now. The last thing I'll say, Robin, is we got to get more people trying this out. Like, we've got to get folks that are willing to raise their hand and go, I'd like to do that. And doesn't require millions of dollars and pilot type things. It requires just an actual desire to make a difference and to use these open standards. And once this architecture is built, like I said, it's reusable for literally dozens and dozens of use cases that will ultimately save millions and millions of dollars in kind of wasteful spending, so that you can redirect it to provide better care to the patient.
Well said. Well said. Dave, what are your final thoughts here on how people can take what we learned today and make hay while the sun shines here?
I think Brian, he summed up a lot of the most important points. One thing I would add to what he's saying is that the architecture he's talking about already exists. It's a well-established standard, OIDC, any of these data exchange flows, and the identity, authorization, authentication, they're already established and implemented on a global scale. So we know that it works. There exists open source implementations and other implementations to do this. So for those reasons, they do offer the shortest path to get where we need to go, to the benefits that Ryan talked about. And it's far too big for any one, party, any one vendor to sort of gatekeep this. It's really important to, overall the health of the country and all of our businesses. And I feel strongly it's the only way to move forward in increasing the engagement of and reducing costs of care for health systems like Providence, by seamlessly integrating the patient experience between providers, payers, and third-party services, including the EMR, to realize these benefits. So yeah.
Totally. Kristen, what are your thoughts for the takeaways here? What can people start doing right now?
Yeah, I mean, one is start socializing within your organization why these subjects matter. And if you need help with that, there's great organizations like Levitt and many others. I mean, I give talks all the time to executive teams around how to think about open standards, open source, the architecture that will support the future of healthcare, even outside of like the work that we do, from a day-to-day basis, because, it's important for people to start to understand this. And what I will say is that many health systems and payers and pharmacies, as Ryan said, it's a really hard time right now for a lot of reasons. And for that, we've been very insular focused. And we haven't necessarily picked our head up and looked around to say, wow, why have there been all of these mandates towards shoppability and transparency? What is it that the government is pointing us at? And they tell a story when you look at the timeline of what is adopted, when is it adopted, and they all tell a story back to a pain point of a patient. But every health system, every payer, and every pharmacy knows the pain points of the patient in their own experiences. So in order to solve that, start creating mappings that show how could we potentially solve this pain point, and is there an open standards framework or architecture that would make this less painful for people? And one of the top metrics of anyone we work with is we should be reducing your call center calls. Right? And so people don't need 200 to 500 people in a call center that are picking up the phone to order a new digital or a new non-digital ID card. They don't need to, pick up the phone to say, what is the status of this or the status of that, right? With prior auth reform, that's all going to transform immediately as well, because there's APIs direct to patient. So if you actually look at the categories of why people contact you, because customer service is very expensive. What are the problems that can be solved with these architectures? It is a way to create a business model case of why you should adopt open standards, open source technologies, and that you can do it now. You're not reliant on anyone else's roadmap. You can just put up your hand, like Ryan says, and says, hey, who else is doing this that I can try this with? I promise you, we can find you a system, a pharmacy, a payer, a lab, or anyone in your region that will say, yeah, we're already doing it, and we would love to partner and do it with you too. And so I think we just need the socialization, because I honestly think that most executive teams have not looked at the big picture of this as a whole to understand it. And when they do, they're going to realize they're going there anyway. It's just how fast they want to go and which use cases they want to prioritize.
Totally, absolutely. So as we wrap up, I do have the one sales slide, because this webinar is brought to you by Priya. So I'm going to show the one sales slide, the one slide that paid for the whole thing. Just want to thank folks for their time today. Priya does work in the space creating OIDC for health systems. We've built the technology on the open technology stack. The reason why you would use us and not build it yourself is because we've done it before. We have it all in a certified environment and a certified framework with SOC 2 Type 2. We provide this as a service. So if you're interested in this today, you want to take control of your identity, reach out to Priya. We support this through both an identity layer, a personalization and experience layer. We have a ton of partnerships like the one I just mentioned with LabCorp. We also work in this space. So our goal is to make the entire world better on open standards, not just to enrich ourselves here. So if you're interested, feel free to reach out. We'd love to speak with you. We'd love to guide you. If we're not the right solution, we'll tell you. We like to have the conversation. So if you want to continue that conversation on the Priya Health side of the equation, feel free to reach out, and our contact details will be part of the webinar. So that was the sales slide. I want to thank everyone for listening. Thank you for your time. Really appreciate the great guests we had today, and be able to share their experiences. Definitely go out. Hopefully the main takeaway here is there is a ton of great reasons to be involved in open standards, and there's a ton of great reasons to take a proactive approach and understand what they mean, understand why they're important, understand that you can create value for your organization no matter where you sit on the value chain by embracing them, and that you don't have to wait for open standards to happen to you. You can be involved and make positive experiences for your consumers and begin taking advantage of them right now. So thank you for your time. Thank you once again to our panelists, and appreciate everyone for joining us today. Have a great rest of your day.